You're watching Iowa Live. Everything local, entertaining, and meaningful in Central Iowa is right here on Iowa Live.
Welcome back to Iowa Live. I'm Terry Rich, and we've had a lot of fun. I have the pleasure today, though, to talk to Chad Glass. And Chad is with MercyOne Health Plan. And Chad, we're going to talk a little bit about Medicare. And this isn't the typical time that people think about Medicare, but there are a lot of people about to turn 65. Things change. So tell me a little bit about who would be eligible right now for the health plans and Medicare.
Yeah, thank you, Terry. Really appreciate you having me. Yeah, and as we sit here on February 12th, we're just about a month and a half, 2 months out of what we refer to as the annual election period, which is the big time of year that folks who are already on an existing Medicare plan can make those changes between October 15th and December 7th. And any changes they make during that time goes into effect January 1st of the following year. Now, as we're moving into February and almost into March, which is crazy to think, we're really talking mainly now to folks who are turning 65. They've got that brand new red, white, and blue Medicare card, and now it's time to take action with that. And we also see folks who are losing employer coverage, or if they had coverage through a spouse. That creates a special election where they can enroll anytime throughout the year. There's also medical diagnoses that allow folks to enroll in Medicare all throughout the year, too. So if you have any questions about that, please use this as a resource. We're so happy to help. You can also contact Medicare about your eligibility requirements, but we're happy and we're just a phone call away.
Now, let's explain this, because people think, well, Medicare, don't I need to call Washington, D.C.? But the way Medicare is set up is they work with private companies like yourself, experts, to be able to answer the question. So almost any question people have about what's going on with Medicare, how do I get this, how do I do that, all these questions, they're able to call you and get an answer right away rather than sit on hold with Washington, D.C., aren't they?
Absolutely, yeah. So as a Medicare Advantage plan, we have a contract with Medicare and we follow all Medicare guidelines. So we can talk to you about Medicare Advantage plans, but also really when you're getting into Medicare and it's a whole new perspective for you and you're gathering information, there's a lot of alphabet soup. There's Medicare Advantage, there's Medicare Supplemental, there's Medicare Parts A, B, C, and D. It's a lot and it comes at you fast. So really deciding what plan is best for you is where to start. You can do that through Google searches. There are Medicare 101 videos that you can even Google and watch and get the full gambit of what exactly Medicare is. You can call us even for just Medicare questions. We're a Medicare Advantage plan, but we're still happy to help navigate you through that Medicare maze because it is confusing. It's overwhelming. There's a lot of information out there. So we're happy to help navigate that for you as well.
And that's options. So you'll be able to answer all of those options and do it in a more concise and I think a more direct. I think that's the real advantage in giving MercyOne Health Plan a call. Well, Chad, let's talk again when they can enroll and why we're talking to them right now.
Yeah. So as I mentioned earlier, Terry, right now we're really seeing a lot of those folks who are new to Medicare. They have their red, white, and blue Medicare card now. They've worked probably for most of their life, ready to hang it up and jump on a Medicare plan. Those are the folks we're seeing the bulk of now during this time of year. But there's also a reason somebody could be eligible all throughout the year. I know I just mentioned that annual election period. Know that you have that each and every year. So if you want to make changes to your plans, you have that time frame to do so. But there are also things like, if you decided you're tired of this cold weather and you want to move to a warmer climate, even a permanent move to a different state gives you a special election period to join a Medicare plan in your new area. I mentioned earlier as well, employer coverage is one that we get a lot right now. Folks who are either voluntarily or involuntarily losing their employer coverage, give us a call because now they need Medicare coverage. And that's just a couple of the reasons why. There's so many reasons out there you could be eligible for a plan. Feel free to reach out to Medicare, do a little research, or call us and we can help you navigate that too.
All right, let's talk about steps that you need to do to be ready to get into enrollment.
Yeah, I cannot stress it enough, Terry, from a Medicare perspective, and I've been in this industry about 15 years now, which is hard to believe. Starting early is the key. This stuff flies at you. You're not ready for it typically. And when you look and you start doing the research, there's so many different companies. There's so many different plan types. As I mentioned, you've got Medicare supplemental, Medicare Advantage, all the parts of Medicare, and it can be incredibly overwhelming. So as you know, Medicare may be on the horizon for you. Start doing a little research. You can, as I mentioned, Google Medicare 101 videos and just get the basics of what Medicare is, what it means to you. You can maybe identify what plan types make the most sense for your lifestyle. And it's also important to lean on professionals as well.
And that's where you come in, isn't it? That's where you guys come in. Let me give the number real quick, 1-800-964-4525. And I can't emphasize enough going through it how complicated it is. You want to talk to the experts. So give them a call, thpmedicare.org/MercyOne. You see the email address right there to call, ask questions. But get started is a big thing because it'll come pretty fast when you're there. Yeah. And you just got to really know what your options are and the dates. Chad Glass, thanks.